Morning, ladies and gentlemen. My name is Dean Michelin. I'm with Valeo Pharma, and my topic is, see if this works. It's blank. I don't have a topic. Oh, it's actually, that's the wrong slide. That's my, okay, we'll go through the whole presentation backwards.
That's helpful, actually.
Now that you've seen it all, we're done. We can go to lunch. I am Italian, I am hungry, so this should be quick. Anyway, I'll start while they organize the first slide. The topic is prioritizing and measuring your marketing mix, and my speculation is it's more important than it's ever been before. It's a tough one to cover in 10 minutes, like every topic, but three things I'm hoping to accomplish here. One, discuss the key considerations to think about when you're developing your marketing mix. Secondly, I'll show you a practical brainstorming exercise that works well in trying to identify opportunities. And thirdly, an example of a program that's out there now, the type of program where you can measure ROI. So why is it so important now? You know, it's always been important to prioritize and measure your marketing mix, but now more than ever, one of the reasons would be, whoops, someone's getting hungry too. One of the reasons would be technology advances. There's a lot better technology, a lot more ways to measure, a lot more linkage of customers, things like e-detailing, e-prescribing, sample prescriptions, social media marketing. Those are all coming to be now. They've been dabbled with for many years, and technology is there now, and it's getting better and better. And you'll see that in an example later. Secondly, new customers. We've got pharmacists, we've got pharmacy techs, we've got nurses, we've got a lot more intervention out there. We need to relook at the marketing mix and figure out how do we address the evolving customers, but keep addressing the current ones that are important as well. How do you prioritize it? Third is regulatory limitations. And fourth is limiting budgets. So second slide, please. Thanks. Is limited budgets. We know we got limited budgets. Reps are declining in number. Generics are hitting, as we saw. Reimbursement's an issue. So you need to have a marketing mix that's effective and can be measured. So, first question, what percent of the marketing mix, and take the marketing mix, take away the sales force costs, salaries and all that, but what percentage of the marketing mix do you think is allocated to innovative programs? Innovative being new in the last year or two kind of thing.
Take one fresh and tender kiss.
So we've got 72% at 10%. So that's interesting, 14% at 25. So lots of room. I think it's going to be more and more as time goes by. Of course, defining innovation in itself is always a trick. Next question then would be, coming up, there we are. If we could go back, please. Is the percent of innovation in the marketing mix, do you think it's decreasing? Do you think it's going to stay the same every year? Is it increasing slowly, or is it increasing rapidly?
And then I saw the Jag slide into the curve. I know I'll never forget that horrible sight. I guess I found out for myself that everyone was right.
So 73% increasing slowly, yeah. I would agree. It's hard to adopt. A lot of the issue is not being able to measure ROI. Coming out with, I've been with companies where they said, yeah, we got to innovate, do innovation, but there's no budget for it, but innovate. And you don't dare innovate with your marketing mix and miss your forecast. That doesn't go over too well. So it's a tricky one. Our industry's a tough one for innovation. You know, you do a separate budget. I mean, one consideration you need to think about right away when you're looking at your marketing mix is where do you want to be with your mix? Do you want to be traditional? It depends on what product you have, what market you're in, what the potential is, what stage it's at. There's a lot of things to think about. Do you want to be leading edge? Take traditional stuff and make it a little more innovative? Or do you want to go way over and be bleeding edge and try something absolutely new, never been tried before? But one thing you better be sure of, the further you go towards bleeding edge, the more you better be able to measure it. For two reasons. One, to justify what you did, and two, to be able to do it better as you keep going with it. So that's a bit of the challenge we have with innovation in the industry. Some of the questions to consider. Are you really meeting or exceeding your customer needs? Do you really know who they are? Are you addressing them in silos? I mean, now you sit and look at your marketing mix and you say, wow, I got to hit pharmacists, pharmacy techs in certain provinces and not in other provinces. There's nurse practitioners, there's physicians, there's KOLs. Are you doing them in a silo? Are you trying to do a plan for every one of them, or are you trying to link them? And that may be where a little more of the secret is how do we link them? How do we get to a point where they're helping each other? And do you even know who they are? What are their business practices? What really makes their business go and what's important to them? And again, it's a challenge as we keep getting more and more target audience, and it varies per province. So to what degree do you think we're meeting all of our customers' needs? All of our customers' needs. Not at all? Some groups completely, others not at all? Okay with some groups, but room to improve? Or okay with all groups, so we're sort of good across the board, but we've got room to improve? Or all of them are completely satisfied? Where do you think we sit with that? So two, some groups completely, others not much. And then we've got some in there, okay across the board, but room to improve. Yeah, so no surprise there. We've got a lot of room to do. I think that the traditional customers we've had, we're probably doing a fairly good job, but as they're becoming new and we're getting to know them, it's going to take a while. So to follow up on that, on which customers do you think we need to be spending more time to satisfy? The doctors? Patients? Let's lump in pharmacists and nurses. They're sort of the evolving ones in provinces, or all of them. Where do you think our real gaps are?
I was born one morning when the sun didn't shine. I picked up my shovel and I walked to the mine. I loaded 16 tons of number 9 coal and a straw ball.
Okay, so we probably should be spending more effort on patients, a bit more in pharmacists, and all of them comes up. So really it's, but now how do you spend more effort on them when we have limited budgets? That's the challenge, isn't it? So I'd like to bring you into a bit of a brainstorming session or a process that you can use to try and identify where do you really hit these customers and how do you find out where they link. There's a process called customer circle of activity, been done by a lot of companies. It